over the years, over the last 5 years, the average increase in people presenting to emergency departments with mental health complaints is about 8% every year. With COVID, it increased by 20% per year. So that's almost sort of double percentage every year, increasing by 20% to emergency department. Most notably among young women, well, girls actually, so adolescent girls, increased by 47%. Huge increase, like massive increase, specifically amongst those in the most socioeconomically advantaged groups, which is really interesting as well. It's not what you would expect. We can't really explain that. The most common age group for presenting to emergency departments with mental health complaints are people in their 20s and 30s, and then people who are over 85. But that adolescent population that's a new finding. So adolescents did not used to present to emergency departments in the numbers that they are currently presenting. And there are hypotheses. So people hypothesize that it might be something to do with social media, isolation, bullying on social media. People suggest that it might have to do with the rise of IT and people or kids not getting out and playing games and getting exercise, which is positive for mental health. People hypothesize that it could be to do specifically with COVID, which makes sense because that's when these numbers arose, and the rise of using Zoom education. So people don't get the interpersonal interaction that they used to get, the camaraderie, the community. Psychiatry tries to approach things from a biopsychosocial model. And indeed, mental ill health has contributions from one's biology, one's psychology, and one's sociocultural background and experience. We talk about all things contributing and filling up your bucket. So if there is a family history of mental ill health, you get a little bit of water in your bucket. And if you are experiencing sociocultural distress of some kind, you fill up your bucket a little more. And the more stress you have, the more you fill up your bucket, until eventually, in terms of mental ill health associated with stress, the bucket overflows and you have trouble coping. And while the things contributing to distress may not be modifiable, the way we manage distress might be modifiable. That's very difficult. This is not an easy thing to do. But there are people out there who can help. And of course there's This Way Up here at St Vincent's, who try and help with people who have struggles with anxiety, depression, panic. And there are other people out there who can help as well. So a psychologist, for example, a psychiatrist, and one doesn't necessarily need to wait until one's bucket completely overflows, but rather to concentrate on how to open the tap a little bit and let out a bit of the distress by seeing someone who can help when the emotion is here, rather than when the emotion is here.